Let's talk about the change in quality of life that a man, and we'll get to women because I really want to get to that because I think there's way more stigma with women using testosterone, of course, than men. But
amen.
Let's start with men for a second here. A guy comes and sees you, low testosterone, signs of low testosterone. He goes on therapy. What kind of changes in quality of life do you typically see with? And I know it's an individual, but what is typically seen with somebody who goes on TRT?
The basics are, hey, doc, I've got low energy. And I shouldn't say low energy because the magic word is really decreased, whatever it might be. Because one of the reasons why we don't see patients as soon as we should is because we've all seen the guy who's bouncing around the walls, right? Or off the walls. He's got natural high energy and he figures, he looks at his buddy, Ralph, and goes, geez, man, Ralph's fat and out of shape on the couch. I'm still working out. I got tons of energy. Nothing wrong with me. It's just old age, right? He shouldn't compare himself to anybody else. He should compare himself to him and say, hey, man, how am I doing compared to 10, 15, 20 years ago? Do I have a decrease in my libido, my energy level, my sense of well-being? My ability to change my body composition, which the first three are personality traits, you could argue, right? And influence therefrom. But change in body composition, that's not, indirectly driven by your personality. Do you get your butt into the gym or not, right? But that one, you got a guy who, especially a successful athlete, who knows all the right things to do and just keeps saying, well, I'll just try harder. I'll do more of this. I'll do more of that. They're the last ones to come in. And really, they're the ones that would probably benefit more than anybody to come in sooner. So those are the, I guess I call them 4 things that most people complain about. Now, connected to that, though, an increased sense of well-being, that can affect your sleep. When you wake up in the middle of the night and think about your 2.3 kids and a mortgage and go, oh my God, how am I going to get through this? When things are going well, you go, shut up, brain. I'll handle it like I always do when I get up in the morning and kick butt because I feel good. I'm wake up feeling like I'm kicking butt. When you have the flu, for example, you don't wake up and think, the world becomes a horrible place for 10 days, right? Why? Not because the world's changed. When the flu goes away, the world's great again, right? It's because you don't feel well. And when you're off because of low T, you wake up and you start ruminating about that. Like, oh yeah, how am I going to make that car payment? And you think about it, you go, hey, I got plenty of time to think about that. Why do I need to think about it in the middle of the night? They're going to send me a nice little letter telling me that my car's going to be repossessed long before it happens. You get my meaning. These are the things that come along with low testosterone that people don't even think about. And once they start on therapy, they go, hey, by the way, I didn't talk about it the first time I saw you, but boy, I'm sleeping a lot better now too. And there's things that come with that because they're working out more often. And of course, that helps you get into a deeper sleep. Things we know that come with the other things that you're doing that can be indirectly because of the testosterone therapy. But those are the main things.
So feel better, higher libido, greater sense of well-being, confidence.
Yeah. Okay. And again, compare yourself to yourself, not to your buddies. Think about it. When was the last time you played poker on a Saturday night with your buddies? The little things that start to go, you say, wait a minute, I'm doing fine. I'm keeping up with my business. I'm doing all the things I used to do. Well, wait a minute. No, I am keeping up with my business, but I used to be able to do that. And like I say, see my buddies for an occasion, a monthly poker match. Those things start falling off. And again, it's for the people that tend to be tougher to begin with that, rationalize that stuff and probably postpone their
I was
trip.
that guy. I was 100% that guy. I waited longer than I probably should have because I thought, give myself more time to probably naturally bring it back up. I was still kind of working out and being somewhat consistent with that. So I'm doing better than this guy. I kept justifying in my head like that. But the 2 big things that I noticed that what finally kicked me into gear to go finally do it was just my drive to even want to get in the gym. For most all my 20s, I remember thinking about my workout the night before because I couldn't wait to go lift. I was excited to train. I was in love with it. And I had lost a lot of that, and yet I was still disciplining myself to come in and go. My desire to do it, I had lost. And then, of course, all the other ones you touched on, I noticed all of those things dramatically increased. The other thing that was really pushed me in that direction is, as a trainer and doing this as long as I have, I know how I need to eat. I know how I need to train to change my body composition, and pretty quick too. I can get it in there. And that's what I was like really getting frustrated with, was one, the drive to get in, and then two, when I was in and I was being consistent and I was eating the ways, my body just was not responding the way it had in the past. And that's what broke me down. If I go, okay, I think I need some help. I don't think I'm going to be able to figure this out myself.
But what about the other thing I was talking about? Did you also look around and go, and I know you'll answer this, so I'll do humility. I'll tee that up for you. But you look around and you go, well, I'm still kicking ass here. Well, I'm still way better than the 95, 99% of the people in there. So you go, and again, it's not to say I'm great, but just to go, okay, well, maybe it is just because I'm getting older, or this is just what I'm supposed to expect. And to some degree, like we talked about earlier, it is normal, but it's not what you have to do. You have to suffer through, right?
No, you're 100% right. That's exactly what I did. Was I'm approaching 40. I'm the youngest of my friends, so all my friends are in their 40s, and I'm looking at, even though I'm feeling all these things, not feeling great, I don't have the drive, body's not changing, I'm still in a better position than all of them, and so I'm going, oh, okay, well maybe it is. I'm just getting older, and all those things are just inevitably going to decline for me.
Yeah. So let's get back. Let's talk about women now, because I know women can also suffer from low testosterone and benefit from testosterone therapy, but there's a huge stigma around treating women. They're afraid, of course, of turning into a man and growing a bunch of facial hair and all kinds of weird stuff. What are some of the symptoms that women go through, and how do they feel afterwards? Is it very similar to what men will feel?
Yeah, this is actually the saddest part, and we're actually making a very concerted effort to reach out and appeal to women more, because actually when I started, I had more women in my practice than men. But I think maybe because of the stigma that you refer to, they just they don't get the right push, they don't get the right answers, and they're kind of left in the lurch. The symptoms they suffer from are the same as for guys. That lack of libido, energy, sense of well-being, call it joie de vivre or whatever you want, and the ability to change their body composition falls off the same way it happens with guys. The problem is, we were kind of reared to look at the hormones, the so-called sex hormones, right, as testosterone is male, estrogen is female, right, when in fact we both have the same hormones. Okay, just different ratios. We men carry estrogen and testosterone in our bodies, just more testosterone than estrogen, and the reverse for females. So that one, that one's very unfortunate. And like I said earlier, I see urologists picking up the ball for the men, but I don't see OBGYNs picking up the ball for females. And so, like I say, they're kind of left in the lurch. And there's a lot of misconception out there. Oh God, I'm going to grow a beard. Oh gosh, I'm going to turn into Arnold Schwarzenegger in terms of my body composition, which, I mean, if you just think about how ridiculous that one is, I mean, Arnold, like him or not, you had to work for that. It's not going to happen overnight, man. You got to put in some effort. Any bodybuilder will tell you that. And so, but they're legitimate fears, because also there are doctors that are writing protocols that are not aware of the potential side effects. And, while men and women have hair in the same places, women just a lot less of it typically, depending upon their phenotype, et cetera. That's a fear, because women don't want to have facial hair for now in this country. I don't think they ever have in the history of civilization. But I mention that because, you look at, 16th century paintings, and, women were kind of buxom back then, whereas today, or just 20 years ago, Twiggy was supposed to be the ideal body type. So things change. But anyway, as of today, women don't want to have beards, right? And so that's a fear. And while it will not cause a beard, it can, and it's, by the way, it's not the testosterone that will facilitate this extra growth. It's something that testosterone gets converted into, called dihydrotestosterone, that it's the fly in the ointment. Mm-hmm. So and by the way, like I said earlier, unless it's a very unusual female, she's got 2 or 3 somewhere on her face, right? Mm-hmm. Like grandma did. When she was 35, they appeared, but you didn't see them until at 75. She says, I just don't care anymore. I've lived long enough. You take me as I am. Yeah, she stops plucking them. Then you notice them, right? Most of the females will have some of this, even if it's just sort of sideburns. My point being that it's driven by dihydrotestosterone, of course, first and foremost by the genes. And it's not the testosterone, but we can block the conversion from testosterone into dihydrotestosterone. You don't have to suffer from these side effects. And unfortunately, we do fix a lot of bad haircuts when it comes to female TRT because they'll go to a doctor that hasn't really given it anything but short shrift in terms of study. And they put them on testosterone. They go, oh my God, that was a disaster. Yes, I love the energy and I love the libido, but my God, I got acne, which is also driven by dihydrotestosterone. And I don't think either sex likes acne, right?
What about the low voice? What's the mechanism there?
Again, dihydrotestosterone is what drives that. Dihydrotestosterone is 2 to 5 times more potent than testosterone in terms of potency and depending upon the receptor, right?
It's a masculinizing hormone, essentially.
Yeah, I mean, that's what we refer to it. The male sex, secondary sex characteristics are driven by that particular hormone more than any other. It's an androgen. And that's an issue. So the good news is for those that are on it and are suffering with some of these side effects, or those who are planning on getting on it and worried about them, we can stop that conversion and therefore prevent the side effects. Or you really kind of have about a 6-month window in which you can reverse them, I've found. So if someone's starting to notice, oh, my voice is getting deeper, because of the thickening of the vocal cords, then we can put them on something to stop the DHT.
Oh, interesting.
And you got about a 6-month window. And by the way, this is what I tell all patients: you can stop, and that extra hair growth will go away. Okay. Mm-hmm. And usually I'm stopped mid-sentence and go, yeah, you told me that, but never mind. I'll just get more laser. Well, okay, wait a minute. I also told you don't have to get the laser either. Mm-hmm. If we put you on a substance, it's usually finasteride or dutasteride. The older docs used to use something called spironolactone, which is a diuretic, a potassium-sparing diuretic. They used to use it ubiquitously for females in acne because they know that as a side effect, it blocks, and only works in females, by the way, dihydrotestosterone formation. I don't think anybody needs to be dehydrated necessarily. I mean, unless they have hypertension, and we can use it as an adjunct. But most athletes, that's one of your worst enemies is dehydration. So I don't use the diuretics anymore. But finasteride or dutasteride even works great to block dihydrotestosterone. Again, people think of it as a male drug, but it works the same in the female. Mm. And
so a female walks in and she complains similar to like maybe what my complaints were: low energy, mood, libido all down, body composition struggling to change. What does and I know of course there's a variance, but what does kind of a normal dose of testosterone look like for a female to help her rebound from all those things?
Roughly 1/10 the dose of a male is what it works out to. Yeah,
so like 20 milligrams or something like that, right?
Yeah, we'll use a testosterone cypionate, 20 milligrams per ml per week.
That's a tiny amount.
Yeah, well, and that's why we got to have it in a different strength, because to be precise is difficult with 200 megs per ml. So we have to get them a different strength, and actually we can get away with 50 megs per ml and just use 0.4 mLs, and it's precise enough to be accurate. So that's pretty much the secret there. And by the way, we were talking about the different delivery systems. For men, without a doubt, clinically, you're going to see much better result with the injectable, anything that's esterified. With women, because it's a smaller amount of testosterone required, is what I imagine part of the reason is anyway. You can get away with the creams and gels, or even orals, yeah. Because again, the argument is that less stress on the liver. I don't think there really is. I mean, you could argue with methylated test, one of the original testosterone orals. Yeah, it was hard on the liver, but any of the others, I don't think you have an issue with. But given that argument, okay, you want to select one of the others first. But there's still the drawback of you gotta put it on, wait for 5 minutes for it to be to dry anyway, and then another 25, let's say, to have it be fully absorbed before you can go, swimming or exercising or whatever. I joke I dropped my candy by not investing in Sephora because my wife puts on a cream every day, several creams. I'm like, oh, geez. And so, male or female. You know, some are like, okay, what's another cream? Big deal. But there's some that say, no, hey, man, if I can avoid one more cream, I'll do the once a week injection. But in terms of efficacy, I don't see much difference for a female, whether they use an injectable or a cream or a gel.
So they're taking about 20 milligrams, and then what else are they taking in order to block the DHI?
DHT.
DHI. I thought testosterone. What'd you call it?
DHT.
DHT, yeah, dihydrotestosterone. Yeah. Sorry, I'll stop with the abbreviations.
No, it's okay. It's okay.
I don't put them on a dihydrotestosterone blocker. We call it a 5-alpha reductase inhibitor. Typically, unless they complain or they've had experience where they say, oh, I did it with this doctor and man, I got acne, or man, I started getting hair in the wrong places. Then I'll say, okay, well, we know that's in your genes. That's what's going to happen to you. Let's put you on from the get-go.
Oh, okay.
But it only happens in about, say, 20, maybe 25% of the females or males for that matter that have side effects. So I don't put people on immediately, but we have a feature in the charting system. It's patient health record, I think it's called, where we can message. So I say to patients, hey, as soon as you see anything you even think is a side effect, communicate with us and we'll put you on right away. But, you know, if we start people on it, then based on what I just said, 75 to 80% of the people are taking it that don't even need it.
So what does the process look like? Let's say somebody's watching this or listening and they're like, okay, I have some of those symptoms. I suspect maybe I have low testosterone. I'm eating right, exercising, getting good sleep, but I still feel this way. What does the process look like? They contact your facility, and then what kind of testing do they need? What does that whole thing look like?
Well, in order to get a prescription, first of all, again, fortunately, unfortunately, testosterone is considered a controlled substance. It's a Schedule III controlled substance. And so you have to have a prescription for it. In order to get a prescription, you have to have a relationship with a doctor. And in the state of California, you have to establish a relationship with a physician, which involves a history and a physical exam. So those are the hoops you got to jump through. Okay. You have to see a physician. I say see. These days, you can get a surrogate physical exam from another physician. I call it a surrogate, so that your primary care physician you could go into today, and then I could use that physical exam tomorrow. Trusting a fellow physician, and then you and I have to talk about what's going on. There has to be a reason for prescribing this. Mm-hmm. So we talk about the symptoms. Like I said, it could be that it has nothing to do with your testosterone. There's so many ways. I mean, there's tons of ways to get a headache. There's tons of ways to have low energy and low libido.
Sure.
So we got to look at typically some labs to help us guide the decision-making process, the evaluation. But it starts with, as I said, you and your symptoms. What's going on with you? What are your we call them chief complaints?
Awesome. So they do that, then they get on, and then I can only imagine that because I've known several people who've gone on TRT and they're just rave about how they feel. I can imagine that the stick rate, in other words, the amount of people that work with you who stay on, is probably through the roof. Do people tend to fall off, or they tend to stick around once they feel the effects?
Yeah, someone who was a crummy salesman because I hated rejection. This is a great profession to be in. Yeah, we have very few people ever drop off because it works great, man. I have a great job. I really do. I don't see sick people. I see people that want to optimize. I mean, sometimes we see people that need to be pulled out of a hole, and that's very, very rewarding. I have a buddy, Joe Rivera. He won't mind. He put all this on not Instagram, but YouTube. His mom came in on 26 meds. 26 medications. She was taking medicines for medicines.
Yeah.
Okay. And we got her down to 4, 2 of which were only temporary because of something else that was only temporary. And we got her off. And she came in on a walker, and then ended up, doing the pool and hiking, miles and stuff. It was really, really rewarding, not just because Joe's my buddy, but because you watch an individual who's being overly medicated. And that was an interesting conversation with her physician too.